Good morning, everyone. Alan Harris here with Seminole County Office of Emergency Management. Today is March the 10th at 10:30 in the morning. There's been a lot of changes since I was with you on Friday. So I want to update you, and I have a computer over here, so I'm going to look a little bit off to the side while I'm talking to you. But we, of course, had our first case of coronavirus COVID-19 here in the Central Florida area, which occurred after I spoke with you on Friday, and we have just received information yesterday about a second case, both of those cases being in Volusia County. Both of those were travel related, and both of those individuals knew each other. So that is the information we have right now. We have 14 cases across the state of Florida. We are, of course, continuing to prepare here in Seminole County if we get any cases here in the county. We continue to monitor the Center for Disease Control and the Florida Department of Health for information, and new guidance is coming out all the time for us and for the members of the public. One of the big things that came out yesterday was CDC changed the policy on travel-related events. So now individuals who have traveled to level 3 countries, that includes Italy, Mongolia, South Korea, and a couple other countries, and then those individuals are asking to self-isolate for 14 days. And then individuals who have gone to level 2 countries, and you can get that at the State Department website, but level 2 countries and or cruise, they're asking for people to limit interaction for 14 days, continue to monitor themselves, and notify the local health department if there are any changes to your health status. Last Friday, I mentioned that I was going on travel. I was going on a cruise to the South Caribbean. I have canceled that cruise. Most cruise ship companies now are giving full refund credits. So if you have a cruise, it's not, I'm not saying that it's unsafe to go on the cruise, but certainly if you have an underlying medical condition, you should rethink traveling on a cruise ship at this time. And then if you are going on a cruise, certainly plan for a little bit of time after it, so about 2 weeks after it, just in the event that something does occur and the ship is having to quarantine themselves, or you are, after disembarking, you have to quarantine yourself. So just plan on 2 weeks after the cruise ship docks that you may have 2 additional weeks before you can actually go to work. So that's something that just happened over the weekend. CDC providing some new guidance, and the Florida Department of Health providing that guidance to us. In Seminole County, we are preparing a lot. We have developed some new cleaning contracts. So once we receive a case of COVID-19 here in Seminole County, enhanced cleaning services will occur at all public locations. So libraries, lobbies of public buildings, community services, juror rooms, anywhere where there's large gathering of people. We want to make sure that there's enhanced cleaning services in all those locations so that we can keep people safe and sound. We also have a tabletop exercise where we're going to bring our health partners in, our first responders, emergency management staff, and other support entities on March the 18th, where we're going to go through not only if we get a suspected case of COVID-19, but also looking into the future. So if we get a large number of individuals, how do we deal with that? So that's one of the things that we're doing as well. We put some hand sanitizing stations all over the public area. So if you go visit a library, if you visit one of our county buildings, a courthouse, things like that, you're going to see a lot of hand sanitizing stations all over the place for that. We purchased some personal protective equipment for our first responders. We want to make sure that they're safe. So that is something that we've done, as well as our animal services folks. As we have heard of at least one transmission of COVID-19 to a dog, we wanted to make sure that we were ready at Animal Services in the event that someone does get COVID-19, they have to go to the hospital and we have to take care of their animals. We want to make sure that the vets and the veterinary techs are also taken care of. I think it's important to go over some public information. And I know you've heard this a lot, but it's really important information. And that is, of course, and we keep saying it, but it's very important, hand washing, right? So continue to wash your hands a lot, whenever you can, very frequently. 20 seconds, that's singing happy birthday twice. Hand sanitizing stations have been placed all over the place, businesses, malls, churches, places like that. Certainly you can use those, but hand washing is optimal. So if you cannot wash your hands because there's no bathroom around, because you're at a park or something like that and there's hand sanitation stations, you can go ahead and use that. Avoid touching eyes, nose, and mouth, certainly with any unwashed hands. And I know that's difficult. We have the itch of the eye and the itch of the nose and stuff like that. But try to avoid that with any unwashed hands. Keep away from individuals who are sick. So if you have someone that's sick in the home, they should be sleeping in one room and you can sleep in the other room. So if you're sick, certainly encourage the other folks to sleep away from you. In other locations, we don't want to spread any illness, whether it's COVID-19 or the flu. We don't want to spread any illness to anyone else in the home. If you are sick, of course, please don't go to work. Don't share this virus. Don't share any virus. So stay at home. That's very, very important. Wipe down exercise equipment, shopping carts, things like that. Things that people touch a lot, you want to wipe those down before you use them. So if you go to the gym, make sure that you wipe the right locations. I was in the gym yesterday and people were wiping down the seats. Well, that's not where you put your hands. So you want to wipe down the handles where you're actually doing some work. So wipe down the handles, certainly wipe down the seat as well, but your hands touching your face, that's the issue. So you want to do that. If you are sick, avoid being around animals, touching animals, things like that. We have heard of one case where an individual, there was some type of transmission to a dog. We haven't heard of any other cases like that, but still, don't handle pets because the pets, once you've handled them and you're sick, they could run into the other room. Now a family member also handles that pet, touches their eyes, potential of a transmission of the virus. If you are sick, avoid public gathering locations. So avoid going to church, sporting events, school, work, places like that. Masks. We've had a lot of questions about masks. So masks are for people that are sick. It's to prevent the virus from spreading. It is not to prevent you from getting the virus. So you only wear masks if you are ill, to limit the spread of the virus. The virus is spread by nose and by mouth, saliva, sinuses, things like that. It will stay on surfaces, but it doesn't go very far. They've noticed that it only goes about 3 or 4 feet. So if I'm talking to someone really close, I could infect them. Certainly if I'm sick, again, that's why I want to stay away from people, and then it could stay on countertops and stuff like that. And that's why we're doing that enhanced cleaning across the county. Consider fist bumps instead of handshakes. And now we've heard some things come out about fist bumps, and maybe that's not the safest. Well, that's better than a handshake. So if you got to do one thing, do the fist bump. Business leaders, think about employees staying at home. Think about how they may be able to work from home. If they are sick, they come in sick, please send them home and wipe down the areas, anything that they've touched. The door handle coming into the office, the countertops, if they were at the coffee station, all of those things, everything needs to be wiped down. Plan on what would you do for continuity of operations. So if 10-20% of your workforce got sick, how would you continue operations? That's something all business leaders should be thinking about. And we have a business leader workshop coming up on March the 31st. It's on our website. You can register for that. And we also have a lunch and learn. It's this Thursday. Anyone can register for that. That is also on our website, prepareseminole.org. So prepareseminole.org. You can go to our website and you can click on the lunch and learn. The lunch and learn is just bring a bag lunch. We're asking business leader, faith-based organizations, nonprofit, leadership, or just if you're interested. come and hear about what we're doing here in Seminole County. There'll be representatives from the Florida Department of Health, Epidemiology, and the Office of Emergency Management there. It's from 12 to 1 at Seminole State College, Heathrow campus. Business leaders also should consider enhanced cleaning of public areas. Faith leaders. So faith-based leaders should consider a couple different things. That tithe plate that gets passed around, or collection plate. Maybe consider a different way of collecting tithes or donations, maybe putting that in the back of the sanctuary instead of passing it around so that every single person touches it before it gets to you. So I know that we've done that a lot at church, where we pass the tithing plate, someone coughs, they put their hand on the tithe plate and then they pass it on to the next person, and now we've infected everybody in the pew. So think about putting that at the back of the sanctuary. Think about how you're going to do communion or not do communion. God understands. God knows what's going on. Maybe communion, if you can't figure out a way to do that, just think about that. That's something for faith-based leaders. And then consider television and video sermons. I know a lot of faith-based organizations are already doing that, but consider faith-based leaders. So I have some questions here, so I want to try to answer those as quickly as possible here. How many people are sick in Florida? So how many are confirmed with COVID-19 is 14 right now. Now I want to set a realistic expectation here. That is the number of individuals that have come back positive that have been tested. Because the tests were not readily available to LabCorp and Quest, the private laboratories that normally do all our blood work and things like that, those numbers may be a little bit low. So we anticipate, now that LabCorp and Quest is starting to be able to test, that those numbers will increase. But right now, 14 in the state of Florida are confirmed, and of course, 2 of those were fatalities, one in Santa Rosa County and then one in Lee County, and that was earlier last week, I believe. So that was very sad news to hear, but certainly something that we need to be aware of. Are there any known cases of the virus transmitting on planes? So whenever you travel on a plane, you want to use the same type of safety precautions. So I was going to, when I was going flying, I was going to pick up my cruise ship in San Juan, Puerto Rico. I canceled the cruise, and then we just were going to go to the beach in San Juan. We ended up canceling the airline flight there, and we're just going to do something here locally in Florida, a staycation, if you will. But when I get on the airplane, wipe down everything. So I have the Lysol wipes or whatever you can get right now, because I know everything's pretty much out of stock. So get wherever you can find something, but wipe down the tray tables, wipe down where you're going to sit, things like that. So you want to make sure that it's as clean around you as possible when you're flying. So we want to make sure that you're safe if you are traveling. Let me see what other questions we have here. So there's a question from Michael about why aren't they testing in Oviedo? So now they are starting to test. So now that LabCorp, now that Quest, now that those private laboratories have those testing kits, they are starting to test. Unfortunately, there weren't a lot of test kits before, so you had to meet certain thresholds to be tested. And really, one of those thresholds was you had to have been to China. So because there was only, and if you really look at it, the whole country has about 2,500 people. The entire United States, only about 2,500 people have been tested. That's just because we simply did not have test kits available. So now we have test kits available. Now that we have labs that can actually get the results very quickly. We have public labs, and now we have private labs. So that you're going to start to see testing take place across the United States. And certainly here in Central Florida. Let me see if, again, they are not refusing to test anymore. That was something that happened earlier. That is not taking place anymore. So that's what has changed. Let me see. Our assisted living facilities, assisted living facilities and nursing homes, they are now having advanced safety and security protocols. Many of them are not allowing people to come through their front doors. They're locked in some cases. You must call ahead. A lot of them are asking some simple questions. Of course, this is our most vulnerable population. So if you look at the fatalities across the country, you're going to find a lot of those are elderly individuals and immune-compromised individuals. So the ALS, the assisted living facilities, and the nursing homes have instituted some enhanced safety and security protocols. So in some cases, and I'm not going to go, I won't be able to answer every single nursing home and assisted living facility protocol or procedure, but we have heard of a few. So one of them is that they lock the door and then they ask questions prior to allowing the family inside. Very simple questions like, have you traveled? Are you feeling ill? Where have you traveled to? Those types of things. Have you come in contact with anyone that was sick? When was that? When was the last time you were traveling? Things like that. So those types of questions are taking place, and then in some cases it's limited. Like you can only go to the room of your family member and then right back out. So there's a lot of different procedures and protocols, and they're all just trying to make the right decision. I will say next Monday, we are bringing all the assisted living facilities, nursing homes, adult daycare, administrators, maintenance engineers, custodial managers, lead nurses to a community workshop specific for them to talk about some of these policies and procedures and to help them. That's being held by through a partnership with the Florida Department of Health, Epidemiology Department, and the Office of Emergency Management. So I see a question about from Barbara. No hand sanitizer. So hand sanitizers will work, or they will. I'm not saying that they won't. Hand washing is better. So if you can get to a hand wash, if you can get to a bathroom or something and wash your hands, absolutely, that's a little bit better. But if you can't, you're in a facility, there's limited bathrooms or whatever, and there's a hand sanitizing station. You're in an office building and you just can't get to whatever it is. Hand sanitizers will work. Masks. Barbara asked about masks. Masks are only for people that are sick. They're not going to help you to prevent the virus. They're going to help you to stop the spread of the virus. So that's why when you go into the doctor's office, they put a mask on you if you're sick. It's because they don't want the sinuses and saliva to come, as you're sneezing or coughing or whatever, to get out into the lobby and to infect other people. Sonia asked about hand sanitizers, rubbing alcohol, things like that. Yeah, it's a challenge for us too. We just ordered some hand sanitizing stations. We've got them, again, up on all of our libraries, our parks, our government buildings, but we wanted to get a few more. The delivery date now is late May, early June for us, so that's government. So it's just there are no supplies. So we're kind of in the same boat as you. We're trying to get those supplies in. Luckily, we have some supply, but certainly we would like to have a little bit more, just because the libraries and those places are very high traffic locations, and the hand sanitizing stations can be used quite frequently. Let's see, I'm trying to see about other questions. And for those that I'm unable to answer the question, just keep in mind we have a staff here at the emergency management team, and if I'm unable to get to your question during this discussion, that we are going to respond to you. So just know that we're going to do that. How many people have actually been tested in Seminole County? I can tell you, I know of at least 6 or 7 in Seminole County that have been tested. All of those came back negative, every single one negative. No COVID-19, no positive COVID-19 cases here in Seminole County. And again, that's the ones I know of. So there may have been some additional ones. The epidemiology team has been working on it. The Florida Department of Health has been working on it. So the number may be a little higher or a little lower, but roughly around 6 or 7 individuals. Is it okay to go out to local events? Sure. I mean, right now there's no COVID-19 here in Seminole County. So local events, What I would ask, though, of course, if you're sick, don't go to any local events. But certainly, if you want to go to the farmers market this weekend, you can certainly do that. Enjoy that. We have a plan here in the county, and there are certain thresholds for limiting large gathering locations. So as we get closer to those thresholds, we're going to start to look at those types of events. So larger events like concerts and events that may get a large number of people, we may look at closing those down a little bit earlier than maybe, say, the farmers market, where you don't have the close interaction. You still have some interaction, but you don't have the close interaction that you would in a concert, where you're right up next to the person next to you, and they cough. There's nothing you can do but to breathe it in. So those, of course, would cancel prior to, say, the farmers market or the art fair or something like that over the weekend. So just know that. So look here. I see something about a cruise in Jamaica. Yeah. So my cruise ship was going to go to, still is, I guess, going to Aruba, Bonaire, Carousel, and St. Martin. I know that as I was reading, because I was reading a lot about cruises, because I wanted to see if I was going to be able to go. And certainly, I'm just like every other person. I like my vacations just like everybody else, and certainly was hoping to do this. But I was reading that some ports had closed down. Some ports have limited access. Jamaica was one of those. So Jamaica did close their port for a couple cruise ships. I think they've reopened it, but that can change. So St. Martin, which is one of the places I was going, had discussed closing their port. I think it still remains open, but that can change while you're on the boat. So if you decide, I'm going to risk it, I'm going to go on the cruise anyways, just know that while you're on the cruise, things may change in that country, and your port may be adjusted as you're traveling. So just know that that's going to happen, and that the cruise ship industry is trying to make it as safe as possible for you. I know certain cruise lines. I happen to be going on Royal Caribbean, and Royal Caribbean had sent us lots of information about what they had done on the cruise ship. Since I'm in they consider me an essential employee. I guess that's nice. Here in Seminole County, it just wasn't logical for the emergency manager of the county to go on a level 2 potential risky vacation on a cruise ship. So I had to make that decision. What about schools? I'm glad you asked that question. So we've been working a lot with Seminole County Public Schools. They have an excellent plan. In fact, I'm going to pull up their plan right here on my other computer. So they've educated the staff in the schools. They put up flyers. They have put some hand sanitizing stations. They have others that are ordered. I know I talked to their lead facilities manager the other day. They've increased the sanitizing wipes for all the teachers in the classrooms. They have enhanced clinic staff. So that's important, and that's nice. Custodial staff has completed the development of the school bus disinfectant protocol. So if your child goes on school buses, they've got a whole procedure for keeping those buses clean every single day. So that's excellent. They have got enhanced cleaning services that they have done as well. So that's real important as well. Since I'm talking about other agencies, my next plan here is actually the elections office. So we've been working closely with Seminole County Elections. They've done training for all their elections office and their poll workers. They have enhanced cleaning services and activities at early voting, and they also plan to have those at the voting precinct. So when you vote next week, or if you're going to early voting prior to, just know that you're going to see some enhanced cleaning services there. When you walk in, there's immediately going to be a hand sanitizing station there at where you check in. So you'll be able to hand sanitize even before you check in. So they're doing a lot of things as well. We will post a link to our Lunch and Learn. Thank you, Tara. So we will do that. Donna asked a great question. Can you get the virus more than once? So there is one case in Japan. We've been looking at this quite a bit. We've been working with our medical director, Dr. Todd Husty. Some of y'all have seen him on TV. He's often interviewed on multiple television stations. He is a medical director for our emergency medical services, does a great job, but he has been researching this, and I researched this a little bit. So there was a case in Japan where an individual tested positive for COVID-19. A month later, tested negative, so the individual was no longer have the virus, and then 2 months later, again, tested positive for COVID-19. So we're still learning a lot about this, but I would say at this point, Donna, based on that and some other information that we've received, there's the potential you could get it twice, but certainly if you use those procedures that we talked about earlier, you can keep yourself a lot safer, and hopefully people are doing that. And I've noticed that. I think anyone that's been going around the community has noticed, and I certainly have. When I go to my grocery store, every once in a while someone would grab a wipe. Just about every single person grabs the wipe, and I've never seen them wipe things down so much as they have just recently. So clearly people are interested in cleaning. It's been indicated, obviously, in the grocery stores and hardware stores where the cleaning solutions are off the shelf. So people are doing a lot to try to prevent COVID-19. Are they testing COVID-19 at Quest and LabCorp? Yes. So at LabCorp, they began last week. At Quest, I believe they were going to begin on Monday. I have to confirm that, but I think that they started that on Monday. And I see our Lunch and Learn was already posted. See, we have some cool staff here that beat me to the punch. So let's see. Still trying to look through the questions. I'm trying to answer all your questions here. I only have a couple minutes left. Dorothy, it is not in Seminole County, so no COVID-19 in Seminole County. Want to let you know that. Let's see. That can change again. Yeah, that can change at any time. So the fact that one person has COVID-19 in Seminole County is not to be alarmed. That's one person in 450,000 residents here in the county. I think it's actually now about 470,000 residents in Seminole County. So we don't want you to panic if one person has COVID-19. Again, those preparedness steps, those protective measures can help prevent you from getting the virus. College campuses remain open. We've been working closely with Seminole State College. I know the folks over at the Emergency Management Office over at the University of Central Florida. Both institutions have great working plans for how they're going to do enhanced cleaning around the area. There's also thresholds on those as well. So absolutely safe to go to the colleges. They'll make those decisions though. So if a COVID-19 case is identified in a school or a university or something like that, there may be certain facilities, certain buildings that are closed down and while cleaning services take place. So that could happen. Just know that it can happen, but right now they have a good plan in place. There are two. Dorothy asked about 2 cases. Yes, there are 2 cases in Volusia County. Remember, those cases are travel related, and both of those individuals know each other. I don't know if they're family or just really good friends. So, but that's what we've seen in some cases. The 2 individuals down in Fort Lauderdale were a couple. The first 2 cases down in Fort Lauderdale, Broward County. We've seen that across the country. The first transmitted case in the United States was actually a couple. So people, again, being together. But remember that protective measure that I talked about earlier. The protective measure is if your spouse is sick, if someone in your household is sick, they sleep in one room, you get to sleep on the couch or in another room. So hopefully you have a guest room. If you don't, you're sleeping on the couch. So that's to keep you safe. Is it safe to go to the amusement parks? Absolutely. My staff just went to Disney in fact, yesterday, right? One of them took a vacation day and went to Disney yesterday. So absolutely safe. Disney, Universal, SeaWorld, all of them have some great cleaning services and things like that are set right now. they'll make decisions as necessary. Again, though, no COVID-19 here in I'll say the Central Florida area, the Orange, Osceola, Seminole area, although we do have the 2 cases in Volusia County. So I'm 1 minute over, so you can, the questions that I didn't get answered, we will have staff that will answer those questions. And I just want to thank y'all. Be safe, follow those safety guidelines. We did produce a public safety announcement video. It's up here on Facebook, so certainly watch that. It's got some good information. I hope that this information was somewhat helpful for you, and I hope that you stay safe. Remember our website, prepareseminole.org. Again, prepareseminole.org. The feature there has a click. You just click more, and it has all kinds of information on how to prepare, what we're doing, things like that. So I hope you'll have a wonderful day. Stay safe and stay healthy.